the ground, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on my beat, put on the map, put on my team. Take out every motherfucker in between, know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm running chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, now I'm looking for.
What's up? What's up, evening? And welcome to another episode of Steve, the Kidney Nurse. I'm your host, Steve Belcher. Thank you for joining, guys. Want to thank the people on TikTok. They never fail. I got a big audience at TikTok, and on YouTube and Facebook, I don't have too many people watching, and that's okay because this broadcast will be replayed. And it's unfortunate. It's very unfortunate that it's a low turnout on free education that can possibly save millions of lives, especially Black lives. Because let's make no mistakes, Blacks are at a higher rate of getting an amputation than any other race. And so let me tell you why I decided to do this show tonight. I was working at a nursing home dialysis unit, and I was walking around making my assessments. And, you know, most of the patients, older, they got covers on right over the cell. So it's like about 7, 8 patients. Like over half of these patients had a limb cut off. You had one double amputee, one that had right leg BKA below the knee. One may had half of the foot cut off. And it was a sight to see because it amplified the seriousness in real time of diabetes and PVD, peripheral vascular disease. And I said, I gotta educate about this because, you know, you may go in some urban cities and you see on the block guys talking on the block or whatever. And you may see 1 or 2 guys in wheelchairs with their leg cut off or something. You wonder, I wonder what happened. And then when you go hear these guys' story, then you're like, oh, I had the sugar. Okay, you had the sugar, but how did it get so out of control that your leg got amputated? Okay. So have you guys, if you watching this show, have you noticed that there are a lot of Americans dealing with limb loss? There's a lot, and you may not think about it. You may think, oh, he had to get a toe amputated, had to get a leg amputated, but you don't think about the reason. Like, what was the cause? Let's not just look at it and say, oh, Uncle Arthur or my mom or my dad or my sister, whoever, they had get their leg amputated. They had to get their toe cut off or their foot. Why? Why did that happen? Because it had to be a reason. And you have to address that reason and not the symptoms. So let's get into this. There's a startling facts. Over 2 million Americans live with limb loss and limb difference. But the risk is not the same for everyone. You may be a white American on here watching this. God bless you. You may say, Steve, I don't have any limb loss. I got diabetes. I know, but you may have had better access. Now, I'm not saying every non-black person, because we have poor blacks, we have poor whites, but blacks, this is just the statistics, are at a high rate. And we all know this. Let's not sugarcoat anything. That's how we move past these stereotypes. Let's just call it what it is. Structural racism, into institutionalized racism. That's not the little man's fault. We're talking about people who 1% who, and then they got other people who enforce that. But that's neither here nor there. The point that I'm making is there's no secret that Black Americans suffer more than any other race when it comes to healthcare, finance, anything. And this is one of them. It's healthcare. So let's talk about trying to not keep, shedding light. We already know this. So now it's time to put action into place and have these type of shows to talk about it. Because if you never thought about it or even, just put in your mind, especially if you got diabetes, that's possible that you could lose a limb, your eyesight, or other health, problems because of diabetes. Now is the time to listen. If you never thought about it, because you could be new in being diagnosed with diabetes and not know the serious implication behind your decisions when it comes to managing your disease. And that's why diabetes and hypertension are the two leading causes of kidney failure. So, and again, people of color, let's make no mistake, people of color are more likely to have limb loss as a result of unequal access and treatment in our society and health system. Again, guys, this is no secret when it comes, and I'm not trying to bait or do any bait thing, but I'm just calling it what it is. When you we can see this from the past. Remember, whites only, blacks only, go behind the store to get your food. So it transferred into the health system that unfortunately millions of blacks become victim of. Also, blacks are more likely to have diabetes and vascular disease. And one may not even think about that if you're watching this and got diabetes. Oh, I didn't know that I'm at risk for vascular disease. Yes, especially if you're young and you don't care that you got diabetes and your sugar's always high and it's not in range. That's going to have an impact on your veins over the long term, because when you have a high sugar level, it damages the veins and the arteries. That's why people have amputation, because if your veins going down to your legs are damaged and you complaining of pain and you don't know anything about diabetes and the complications, And you're like, I tough it out. Let me take Tylenol. And you go to your doctor and they say, okay, instead of sending you to an endocrinologist, which is a diabetes person to deal with that, he messed around and write for gabapentin or what's that medicine that they treat fibromyalgia with? One of those mental medications, right? Uh, I can't think of it, but they using other medicine that's used for like mental illness because one of the effects is it helps with pain. They give you that, nothing still seems to work, and you're like, shit, man, ain't nothing working. You don't go back to the doctor. Next thing you know, you may be walking around the house with setting, vacuuming, cleaning up. You don't have no shoes on. And next thing you know, you may step on something, cut your foot on a nail or something in the carpet. And you don't think nothing of it. You look at it, oh, put some alcohol on it. Neosporin, that's what I was thinking about. You put some Neosporin on it. And you just going about your day, you put a sock on, put a Band-Aid on. Don't even think about it no more. And then 2 weeks, 3 weeks later, you got this throbbing pain. And now you take off your sock one night, you come in, go upstairs like, damn, my foot been hurting all day. You get upstairs, you take off your sock, your shoes and socks, and now the bottom of your foot is black. Like, what the hell is going on? Like, how did this happen? And you scratching your head, wonder, like, what do I have now? Not knowing that that's from the diabetes. Because that pain in your legs, your feet, that you've been trying to treat with gabapentin now has become so damaged that there's no blood flow getting to that wound so it can heal. Because blood has protein and all the nutrients that help a wound heal. So now you go to your doctor, you're like, look at this. What the hell is this, doc? Now they want to send you to wound care, vascular, to have a look at it. So that's when you need to educate yourself to see, hey, is there any way that you can work on my legs, open up the veins so blood flow could come down so we could restore blood to that wound? But a lot of people don't know to ask those questions. They go along with the surgeon and go ahead and chop it off, whatever the case may be, when it could have been saved. So again, diabetes and vascular disease are the two leading causes of limb loss. Okay? And again, it's just unfortunate and discouraging that only one person is watching on Facebook or YouTube. Very discouraging because, again, this disease, diabetes and peripheral vascular disease, impacts millions of people, especially blacks, right? And I guess a lot of people may not want to hear the truth, but that's where knowledge is power. And we all know that Bible verse, my people shall perish for a lack of knowledge. So let's talk about racial disparities in limb loss. The statistics are frightful. Listen to this. Black Americans are much less likely than white Americans to undergo procedures that can prevent amputation. Repeat that. Black Americans are much less likely than white Americans to undergo procedures that can prevent amputation, known as limb salvage. They have something that can prevent you from getting an amputation called limb salvage. But what if you're at risk and the doctor doesn't tell you about this, or they don't know? You don't want to be caught with your pants down with a practitioner that don't want to help you preventive wise. If you fall in the risk category of possibly losing a limb, you got a wound, you're watching this and you're working on wound care, stick to it. Don't let them say, let's amputate. Find out what are all your options before you go under the knife. Also, blacks are 4 times more likely to experience amputation for any reason than white Americans, and nearly 2 times more likely to experience diabetes-related amputations. So what did that tell you? What does that tell you? That Black Americans are at a great risk and need to do something to change this around. Like I told TikTok before I came on live, the show, it's 2023. It's no time to be cute if you walking around with diabetes for 5, 6, 7, 8, 10 years, or hypertension. Those days are gone. And see, these dialysis corporations, Fresenius, DaVita, like I said, I've been doing this 37 years. Probably when I started, a lot of you who are watching right now probably wasn't even born. And so they already knew what you want to call them, visionaries of healthcare. I guess you could say they understood the assignment because they implemented scales of economy. They knew When they saw the statistics back in the 90s and the 80s, when they start putting these fast food places into place, and they start doubling and doubling. And now you see a lot of people, especially in Southern California, half of the damn state has diabetes. There's no way in hell that in Inglewood, California, you got more dialysis clinics than you have McDonald's. What does that tell you? This is the business model of these large corporations, dialysis corporations. They look at the demographics of a community and find out where the high rates of diabetes and hypertension and heart disease and all these other chronic illness, the areas. And you know the private value. And then they set up shop. This is not the time to be cute, ladies and gentlemen, especially if you're at risk or you have diabetes or hypertension. I was going to say I have stage 2, but just today I found out my GFR went up to 92 from 87. I'm not joking with this. I know the impact that can happen. I've seen it over 37 years. And that's why I'm bringing this information to you so you could be mindful in how you manage your health care. Because a lot of people don't think about managing their health care. Again, a lot of people dealing with day-to-day life, going to work, taking care of the kids, getting them to soccer practice, doing this, doing that. But when are you going to take time for yourself? Because when you're dealing with diabetes and hypertension, these are preventable. So again, 2023 is not the time to be cute if you got diabetes and hypertension. This is the year of information. And you see on TikTok and all these other social media what's going on in the hospitals, nurses and CNAs back and forth arguing. You see nurses going on strike in New York. You see the destruction of the healthcare system coming down around you. So this is not the time to be cute with your own healthcare, especially when it comes to information. Reading the comments. Thank you, Larry, Margaret, and Patrice Jefferson. Yeah, Larry says, I just don't understand why more, especially blacks, are not listening to you. I don't know, Larry. I'm not asking for nothing. I'm not saying, here, send money to my Cash App. I'm not asking for a dime. I'm just asking for people to listen. And unfortunately, this is how it's always been. And I hope it doesn't be as always will be. I hope there's a change somewhere where people will start listening, participating, and changing their lifestyle and mindset so they don't fall a victim of circumstances of having a limb loss and want to know why my toes get cut off. Why did I get below the knee amputation? Now they mad at themselves because they knew if they would have did this, then this wouldn't have happened. There's a reaction for every action. So you may say, Steve, racial disparities. Race, what are you talking about, man? And check this out. Our Latino brothers are 1.5 times more likely to experience amputation for any reason than white Americans, and 30% more likely to experience a major amputation related to a diabetic foot infection than white Americans. Now, what is it? You may say, Steve, what is it with all these foot infections? How does this happen? Just like I said earlier, if you got diabetes and you had it for a long time, now it may start affecting your veins in your legs, are hurting, toes hurting, and you wonder what's going on. Don't even know about PVD, peripheral vascular disease, and how diabetes is starting to eat your veins up. You don't know that. You just think you got diabetes, and if you didn't research what diabetes is, the complications behind it, which on the average, a lot of people don't do. I got diabetes, you go to the doctor, you get your metformin or whatever diabetes medicine they subscribe to you, and you keep it pushing. So now, again, you got pain in your legs, you go to the doctor, and instead of them saying, okay, let's go have an angiogram, or let's go to send you somewhere so vascular can look at your legs. Hey, Keisha, look at your legs and see what's going on. See if all your veins are open. And see if that's not what's causing the pain. Not just give you gabapentin or I can't think of that medicine they use for mental health, and they use it for fibromyalgia. And then you see that's not working. And so if that's not working, then you know the problem got to be serious. And then again, next thing you know, you say, forget about it. Shit, you got to go on with life. Life is still going and moving. Life doesn't care if you got a wound or your feet hurt. Life doesn't care about that. And then the next thing you know, you could be vacuuming or doing something, you got no shoes on. You're not thinking about anything. You walk around all the time in the house with your shoes off, like any other day. But this day, you cut your foot or whatever, and you don't think nothing about it. You know, you put a little Neosporin on, think it's going to heal up, Band-Aid. You keep pushing. You're not looking at it with a mirror. You're not keeping it clean. You're not washing it. Next thing you know, 3-4 weeks later, your toe is black. And you're like, what? You don't know what it is. And you go into the emergency room. You know you don't want to go because you're going to be waiting there 15 hours or so. Now you're sitting in there worrying. Oh my God, what the hell is going on with my foot? It's aching. You want pain medicine? They ain't giving you none. And you know how that is now when it comes to pain management. We got pain management advocates on TikTok telling you what they go through for their chronic pain. Those days are over with for going to the emergency room thinking you're going to get Dilaudid. Let me put this up, what Keisha said. God bless you, Keisha, for sharing your story. Keisha Champion on Facebook said, now this can happen to anyone. When I'm looking up, guys, I'm looking at the TikTok crew being simultaneously back and forth. But guys, Keisha from Facebook said, my circulation is terrible in my right leg. I've had my baby toe on my right foot amputated. Started with an ant bite. An ant bite. And got infected. You're welcome. You're welcome. Lyrica, thank you. That's what it is. Lyrica. They want to give you that and gabapentin. Manage the pain when the pain is from reduced circulation. Don't let them give you the okie doke. It's the reducer. That's what you got to go in and start doing a preventive checks, foot checks, and if you need to get like a revascularization where they open up your veins and do a bypass, they can do that. But if you don't know and you go along with the status quo, then that's what's going to happen. Also, I mean, nobody is spared from this. It happens to white Americans, but not as much. And you may say, like Steve, why is it that then that blacks are more likely than whites to get amputation and not get preventive? Again, it's, comes from lower household income, correlates with higher rates of amputation, particularly due to diabetes. People living with limb loss who have a household income at or near the poverty line were up to 3.5 times more likely to experience barriers to participate in work and community life. That's just how it is in a lot of urban communities, unfortunate. And that's why I do these shows, because, again, if you live in an area where you got a lack of education, lack of resources, and a lack of other things that put you in a position to be treated or have prevention measures, what do you do? Oh, and Keisha says I can't have that, which I'm talking about the angiogram, because she can't have it die because she had a transplant. You see what I'm saying? So that's why this education is so important, because somebody may be watching, be like, oh, I didn't know that. Like, you may be dealing with diabetes, had a transplant, and you may be dealing with infection, foot infection, whatever. And you may want to know, like, why are you not doing this, doing that? And you got to think about the transplant and the dye, especially if the doctor want to do one. You were like, hey, wait a minute, I have a transplant. You don't want that dye to impact that kidney. Hey, Larry, how you doing, man? Good to see you, brother. Larry says, Steve, you're the only one that's trying to teach the dialysis patients how to handle and get the correct medical treatment. Hey, man, I'm just trying to do my part, Larry. That's all, brother. Vascular doubt. Oh, Keisha said, the vascular doctor highly recommends I walk as much as possible. So again, guys, if you're dealing with or you at risk for a vascular disease, peripheral vascular disease because of diabetes, try to get out there and walk. Don't take, you go to the doctor, you got pain. Don't let them just give you gabapentin or Lyrica or something for the pain. Find out what's causing. See if you're at risk where you have PVD, peripheral vascular disease. And then if you do, find out what are your options. Can you get limb salvage where they do procedures to open up your veins to have more blood flow coming down? Now, as I was mentioning about the disparity, we got lack of education. People don't know. You got lack of people don't have insurance. You got a lot of people on Medicare that don't know that they can get free preventive measures for diabetes, foot checks. When you're dealing with everyday life and other stressors, no one probably think they got the time or want to deal with that. Again, until it's too late, until you actually happens to you and it shuts you down, and now you got to change your whole lifestyle that was preventable. So they say diabetes often leads to peripheral vascular disease, PAD. I'm sorry, peripheral artery disease, PAD, which restricts blood flow to the limbs. Again, diabetes often leads to peripheral artery disease, PAD. So if you're at the hospital, you see your medical records and you see like history, like PAD, like you get your medical records or discharge and they may write like your medical history and you see PAD, that's peripheral artery disease. And you may have it and they may not even tell you. So you walking around not knowing you got PAD. Black Americans experience PAD at 3 times the rate of white Americans. 3 times. PAD is a type of vascular disease, and nearly half of people who lose a limb because of vascular disease will die within 5 years. Okay? This is a higher 5-year mortality rate than breast, colon, or prostate cancer. What do? You got to educate. When you hear numbers like this, makes you think, why no one is talking about it? People are suffering this every day. Every day. We have Keisha here, and she shared her story. She's just one of millions. One of millions. And you still got people walking around that has a wound on their foot or getting some type of wound treatment, or even right now under the knife or just had an amputation because maybe they didn't know about the wound, or they wasn't educated enough, or they could have fell victim of circumstances. Especially if you never had diabetes before. How all of a sudden As a child, you never had diabetes. In your 20s, you didn't have diabetes. 30s, and now all of a sudden you're 38, 40, you told you got diabetes. It's like, what? Yes. What are you eating? What are you ingesting? Are you working out? Are you smoking? What's your blood pressure? And then next thing you know, person 45 years old, 2 toes amputated. And it's like, how do you go from never being a diabetic, now you're a diabetic, now all of a sudden at 45 you got 2 toes amputated, got some vision issues. It's like, how did this happen? How could diabetes to me? So this is where the education comes in, to try to prevent that, to try to get one to think about, if they do got diabetes, to be mindful and to try to conquer it the best way you can, so you don't fall victim of these symptoms and complications of this disease. And there's many. Amputation is just one, like a common one. I haven't even talked about blindness or heart issues behind diabetes. So again, Black Americans on Medicare. Let's take it a step further. Black Americans on Medicare. And we know there's a lot of Black Americans on Medicare. That's no secret. Black Americans on Medicare are 3 times more likely than other patients to lose a leg to amputation because of complications with diabetes and peripheral artery disease. I said that once. I'm reading off of 2 papers now. Just to reiterate this. Thank you, Keisha. I appreciate you. Keisha comments, diabetic. Okay, let's look at this. Keisha says she's a diabetic for 24 years, kidney disease for 11 years before kidney pancreas transplant in 2012. Congratulations to you, Keisha. And thank you for sharing that story. I've experienced even blindness in my left eye. And let's not leave out heart disease. I mean, guys, Dave, you watch it from TikTok, there you go. I just read a comment from one of my audience watching from Facebook, who shared that she had a kidney pancreas transplant. She's been a diabetic for 24 years, kidney disease 11 years, okay, prior to the kidney pancreas transplant. And she even experienced blindness in her left eye, okay? And that's, and dealing with heart disease. And so if you're watching this and they told you pre-diabetic, you pre-diabetes, it's either diabetes or you don't have diabetes. But if you've been newly diagnosed, all hope is not lost. But you got to turn it around before it's too late. You can't sit on this. You got to be proactive. Oh, Keisha says she's no longer diabetic. That's right, because she got a pancreas. But when she was, she could tell you it's no joke. It's no playing, it's no laughing matter. And like I said, you see a lot of blacks this happening to, and it's almost been like acceptance, like it is what it's going to be. No, let's stop this pattern of thinking that way, that it's meant to happen or it's doomed. Because there are preventive measures to this. Maybe you're just not getting the information. Now, in the southern states, like Mississippi, Alabama, Georgia, South Carolina, these guys have a high rate of amputation. Down in the rural South, down in the rural South, like Mississippi, for example, Mississippi shows some of the widest disparities by race, according to one study. There were 14.2 amputations per 1,000 beneficiaries for Black patients in Meridian, Mississippi, and 16.1 in Tupelo, compared to 3.8 and 4.7 respectively for non-Black patients. You see that gap? You see, this is in Mississippi. 14.2 amputations per 1,000 beneficiaries in Meridian, and in Tupelo, 16.1, compared to 3.8 and 4.7 respectively for non-Black patients. What does that tell you? We got a lot of work to do. That's what it tells you. We got a lot of work to do, especially when it comes to education. So type 2 diabetes is a condition, they say, which your body doesn't use insulin properly and causes blood sugar levels to rise. It can result from lifestyle factors such as poor diet, low physical activity, and type 1 diabetes is a condition in which the body doesn't produce insulin. So you got type 1 diabetes and type 2. A lot of people are dealing with type 2. It's not your fault if you got type 1, because you was born with that issue. But if you got type 2, that's the one that's preventable. Type 1 only impacts 5% of patients. And it's usually diagnosed in children. However, both types, type 1 and type 2, can result in amputation if the disease isn't properly managed. That's why this education is so important. So you can, if you are at risk, or you deal with diabetes, or you find yourself at risk for PAD, peripheral artery disease, that it will put you in the right mindset to do something about it. so you don't find yourself in a wheelchair. Nearly 100,000 leg amputations are performed annually in Medicare patients. 100,000. That may not seem a lot because of the world population, but that's a lot of patients. Every year, 100,000 people. 5 years, 500,000. Like, God, dog. And more than half of them occur in patients with diabetes. So 50,000 people who have diabetes out of that 100 get amputation. So, guys, share it on TikTok, especially TikTok. Go ahead and subscribe to my YouTube channel. You don't want to be a subscriber. Let's see, most of it. Yeah, it's unfortunate. So you don't have patients need to start thinking of seeking preventive care. If you got diabetes, now is the time. If you haven't already done so, start doing foot checks. Start seeking preventative care. Also, that means surgical treatment to restore blood flow. Amputation doesn't always have to be the answer. So let me tell you about PAD. Diabetes can lead to peripheral artery disease, a circulatory problem in which narrowed arteries reduce blood flow to limbs, causing pain or numbness. Now, this is what I was talking about earlier. Again, diabetes can lead to peripheral artery disease, especially if you had diabetes 10, 20 years and you're starting to have pain. Now, listen, peripheral artery disease is a circulatory problem. It's a circulatory problem caused by diabetes in which narrowed arteries, the blood flow going down to your extremities, down to your toes, going through your legs, and all through your body. But we're talking about the feet and the legs. In which narrow arteries reduce blood flow to limbs, causing pain or numbness. And this is what I was referring to earlier, where you go to the doctor and you have these complaints of pain and numbness, and they know TikTok, that diabetes can lead to peripheral artery disease and that you may be dealing with this pain because of that, but they're going to still give you gabapentin or Lyrica, some pill, to try to putting a Band-Aid on it when they're not getting to the meat of the problem, which is reduced or narrow arteries, which is reducing the blood flow to the lower level of your legs. And that's where you come in and go to a vascular person so they can look at your veins, see what's going on. Now check this out. if there is an ulcer, and we all know what an ulcer is, wound, if there's an ulcer or a sore on a patient's foot, it can result in a life-threatening infection because blood cannot circulate to the leg properly. So that's what I was saying earlier. If you got an ulcer or a cut or a sore on your foot because of, you could have scraped it against something. You could have been walking barefooted, stepped on a rock, something. You know, at night when you walk in, get up, go to the bathroom, you stub your toe or you hit it against something. That's where these, or unfortunately, that what happened to Keisha Champion, she had an ant bite. Something small as an ant. So this is where prevention comes in. Amputation should be the treatment of last resort. You need to restore that blood in your leg before thinking about any type of amputation. And unfortunately, Black Americans on Medicare are less likely to seek routine preventive care. Preventive measures include foot exams and controlling cholesterol and blood sugar levels. Why? If you're on Medicare, they pay for preventive measures so you don't have reoccurring issues that lead you back into the emergency room. That's what preventive care is for. But if you're not thinking about it or don't have any idea, how would you know to even implement that? Again, this is where these educational program or sessions come into play that I do. If you don't get anything else out of this broadcast, at least go get yourself checked out if you got diabetes, hypertension. If you're at risk, go get checked out so you don't fall victim of circumstances. If you don't get anything else out of this broadcast, now sometimes surgical methods such as bypass surgery are used because patients can improve when blood flow to their feet is restored. This is why you have to ask, you should ask questions. I'm not going to say what you have to do or what you should, what you need to do, but you should ask questions when it comes, like if you a victim of a wound and it's not healing and now they talk about maybe surgery, you need to be talking about some other type of method. But can we do a bypass? You know, don't let them dictate what happens to you. And this is the thing, in this report, like you got patients that have an opportunity to become more involved in decision making about their care and could prevent amputation, but they don't do it. Persons have opportunity to be more involved in decision making about their care and can prevent amputation, but don't do it. Tests for blood sugar control and cholesterol levels are inexpensive and universally available. These tests are inexpensive. It takes nothing to test and see what your cholesterol level is, especially if you know you've been eating a lot of fried food. All this is preventable, guys. It's entirely preventable. In a way, we need to probably reduce disparities. Healthcare providers need to address social and economic issues, such as barriers that prevent patients from eating healthy and the affordability of prescription medications patients receive. But we all know that the healthcare system is right before our eyes. Nothing like we never seen before. So it's more important to learn all you can from a trusted source, because you don't want to, again, be victim of circumstances. So with that being said, guys, please take control of your health, educate yourself, research, tune in to programs such as Steve the Kidney Nurse when I'm talking about important matters such as diabetes and amputation. This can possibly save someone's life or prevent them from getting an unnecessary amputation. So with that being said, let me, Keisha Champion said, please. Yes. Keisha also says, doctor had no choice. I tried for about 5 months. My toe no longer looked like a toe. He amputated at the right time. And he waited. If he waited any longer, infection would have gotten into the bone. And that's not what you want. If you get an infection in the bone, it could possibly move over to the next bone. And this is where they start. You got one, then they go to the next, then they go to the next. Then next thing you know, all your toes are gone. Then next thing you know, they cutting below the ankle. I've seen it so many times. Start with one toe, then all of them, then the ankle, then next, they're not finished till they get below the knee. It's like, why you didn't stop all this beforehand? Yeah, and people, please, Keisha always say, be careful. Even wearing tight shoes can cause you to get a wound. If you like to wear stilettos and you got diabetes, or you're a male and you like to wear those shoes that like close at the toe real close, it's kind of like pushing your feet in, your toes. You got to be careful with that. Keisha said, can you explain plaque on around the arteries? So the plaque with the peripheral artery disease, the plaque comes from the cholesterol and the saturated fats. That's why they mentioned it here about, where was that? With the preventive care. of it says Black Americans on Medicare are less likely to seek routine preventive care. Preventive measures include foot exams and controlling cholesterol. The cholesterol is what's fueling the plaque. And when I say plaque, that's the buildup of like fatty plaque that's causing the blockage of blood flow to go down to the legs. So they put these wires in your veins to try to strip the plaque out of there, right? And so that again, that builds up from cholesterol. That's why they say reduce your cholesterol, reduce your cholesterol. Man was 300 back in June. And you know, see, I'm not that big. You know what I'm saying? But back then I was 206 and down to 188, 180, something like that, 185, you know. But my cholesterol was through the roof. But I know what caused it, me eating late night. Fried chicken and fish and, you know, I was like, enough of that. And I know better, but I'm not perfect. No one's perfect by any means, but I try to be a better person today than I was yesterday. So I want to thank people who showed up on my YouTube and Facebook feed and commented. We got Larry Hall. Peace and blessings, Larry. Larry Keith Hall is the guy that sued DeVita and won his case because they kicked him out. And he sued them. And now he goes to a hospital 3 times a week. They blackballed this guy. But thanks, Larry. I appreciate you commenting, man. Hey, Margaret, thanks as always for being a supporter. I appreciate you. Miss Patrice, thank you for watching the show and commenting. I appreciate you. And Miss Keisha, most definitely appreciate you and sharing your experience with amputation and your pancreas transplant and kidney transplant. That's awesome. Since 2012. So with that being said, I'm going to close the show on YouTube and talk for a little while on TikTok. So again, thank you guys for watching and tuning in to Steve the Kidney Nurse as I discuss Blacks, diabetes, and amputation. And look, guys, seriously, if you got diabetes, and if you haven't been checked for PAD, peripheral artery disease, please mention that to your doctors. Try to control your blood sugar, try to control your cholesterol, exercise when you can, lower your sodium, drink water, and do what you can do to eradicate this diabetes if you can. Some people, they probably had this disease for so long, right? All right, Keisha, had it for so long that now you can't get rid of it. And that's where management comes into play. Hopefully you can, but if you had it for 24 years, you might have done some damage. Especially if the blood sugar wasn't controlled. So guys, please be mindful if you got diabetes. Don't take it lightly. Again, diabetes is the leading cause of kidney disease and kidney failure. With that being said, guys, I'm going to go. I'll be on TikTok. Stay blessed and encouraged. And I'll probably be back on. No, I can't do tomorrow night. Tomorrow night is going to be another long day. That's another story. But if you want to hear that story, just go on TikTok. So with that being said, good night, guys. Thanks for watching. God bless, and we see you soon. Peace.
Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would, and now I'm running. You don't wanna follow me, now I'm fucking